And welcome to the Business Spotlight. I'm your host, Patrick Dewar. Today I've got a great show. We're going to talk with a frequent guest, and that would be Dr. Mary Swift. She's the 2011-2012 Consumer Choice Award winner for cosmetic dentistry. We're going to talk about something that you hear a fair amount in the ads on teeth whitening, but they have a unique twist. They have a way of literally creating a life of brightness in your smile, and so you're really going to enjoy this show. Thank you so much, Dr. Mary.
Hi, Patrick.
It's always good to have you on the show.
Good to see you.
I love this topic because I went to your office and we actually went through that process, and I went from something that was close to dingy to a lot brighter. It's your fault.
So much fun. It's so much fun. It's the most frequently asked for procedure in dentistry today.
Is that right?
As our smile ages, it yellows. And so taking your teeth up 5 or 6 shades in one hour, basically, I mean, you just feel brighter inside and out.
One of the things that I was really surprised about, because before the show I was talking to your husband, and he was talking about those the strips. Some people try to use those strips. Now, he said you would have to use those for like every day for a year to equate to one session of your 1 hour experience. Is that about right?
Well, everybody whitens at a different pace. But if you review the ways you can whiten your teeth, there's everything from over-the-counter strips that you buy, take-home methods, and in-office methods.
Right.
Obviously, the least expensive, most available to the public are the strips, but they are not allowed to have the strength in the formula that we can do in the dental office.
Right. But then you guys have a method, like what you did for me was something that was very quick.
We used a laser on you.
Now, tell me about that. Like when you think about, I never saw any lights,
Yes.
but yet there was a treatment that you went through.
Yes. Laser whitening is the use of a laser beam to activate the molecules in the whitening agent, make them move quicker, and react on the tooth surface faster. There's another very popular, well-marketed method that requires actually a light that sits outside your mouth. That's not a laser. The laser would be the little wand that goes close to the teeth.
Right.
And there's actually some peripheral damage to skins if women use. It's like a, yeah, I mean, I say that. I have heard. I have not seen firsthand. I think it's, but I've heard if a female patient uses any retinol products, which almost all of us do, or males, that is one contraindication. In other words, you shouldn't use an outside light source. So what the laser does is it allows us to get that activation closer to the tooth with big results.
Now, you guys have been doing this technology for a while, haven't you?
Yes, yeah, 10 plus years.
10 plus years. And I know that you've been one of these people that's always embraced technology at a rapid pace. You were way ahead of the game on a lot of that stuff. Was this something like that? For you, was it you were kind of cutting edge, even bleeding edge, so to speak?
With a laser, no bleeding.
See?
Which is the beauty of it. And in cosmetic dentistry, especially, you're looking at not just the teeth, but the gum line. And there has to be formulas and symmetry to assist us with beauty. And if you use a scalpel to create the gum contours, there is a healing process that the tissues will shrink back before they get where you want. With a laser, because you melt instead of cut, everything stays put. So it allows me to sculpt a gum line at the same time I sculpt a smile with porcelain.
So you're saying that your laser actually helps to create a better gum line as well?
Yes.
And it kind of seals it in place is what I'm hearing. That's what I heard. Is that what you said?
Thank you.
I get
lots of talking, and I don't know if I hope everyone understands.
You want to make sure that people are getting it, but I'm still going, well,
yeah. Well, and so that same laser is the laser we use in whitening with a different attachment to it. So lasers have been very valuable in my practice.
And is that something that you manually or program when you're using it?
Both. You have some sets, but you titrate it based, ambient light, other factors. Yeah.
For all those chemistry majors out there,
they're going to love it. They would love the science of whitening.
I'll bet there's
and its origin is quite interesting.
In the next section, I want to actually get into the origin of it. And one thing that if somebody's catching the show and they're catching either the first segment or whatever, are there people that shouldn't do whitening?
Yeah. Do you want to get to that now or when we get back?
We got it about
people that don't have healthy teeth.
People that don't have healthy teeth.
Yes.
Okay.
You need health before beauty, so you never want to apply whitening agents to unhealthy surfaces.
Oh, okay. Well, I know as we get into the next few segments, and folks, if you're listening to us in the DFW area or Houston area, thank you so much. I hope that you go to the Dallas Cosmetic Dentistry.us site and visit Dr. Mary there. Or the other thing is, go like her on Facebook. You'll find her in Dallas Laser Dentistry there as well. And with that, I know we'll be right back after these messages. Thanks again. More of the Business Spotlight.
I've worked every position in the office. I've been a dental assistant, I've been a hygienist, and now a dentist. And it's made me a better caregiver on every level for my patients. One of the things I think I've learned over the years is where to put my technology money. You can buy the latest and greatest and it sit on a shelf, or you can figure out within your practice what's going to make the patient experience better. My practice offers several cosmetic procedures that are enhancing smiles with whitening, with Invisalign, the invisible braces, with porcelain work. So we see people's lives improve when we give them a beautiful smile. That's rewarding. The latest and greatest tool I have that keeps me excited is probably the Invisalign, invisible braces. It has allowed me to evolve my practice into a philosophy of move it, don't remove it. In other words, where I was before I had that tool, move it where I want it instead of putting something on top of it. Staying involved in dentistry on every level, local, state, and national, makes me a better dentist for my patients. I would hope that my patients would feel that from that phone call, even that initial phone call, all the way through to the end of their experience, that it was the best care they've gotten ever. When a patient, especially a very nervous patient with some dental anxiety, when they send their friends and family to us, then we know we've done a good job. That's the biggest compliment we can receive. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.